as well. But the first step is at least getting knowledge of who's out there and what are they doing? What are we all doing? There's a lot of note to AI people on here.
People sent their avatars to take notes.
When I look at, there's like 3 squares that are not real people. Okay.
Yeah, I don't know where they come from, but they always sort of pop up
Yeah,
on
for
our
the
Zoom.
AI, for the
Yeah,
meeting notes.
yeah.
And me and Jamie were debating right when I hopped on, but we're gonna go ahead and record just to consider sending it to the people who have already said they want to be a part of the community and submitted their emails but aren't able to attend today. So Clarissa, is Katie, she's still 50-50? What's her split?
So Katie is actually more like 80-20, I would say, but she's right now just focusing on our oncology patients. I get to do the rest of our patients.
So she mostly does palliative within oncology for
Within oncology, yes, with our oncology patients.
I'm so excited for you.
I am too. I mean, like you definitely were instrumental in this for sure, with your guidance. So I am super excited that we get so, we have been able to prove that the necessity, right? Like the need and being able to, be used in different sources and feeling less like I think when we talked about it was I love Gen Peds, but both things, palliative care, pediatric palliative care, Gen Peds, both of them are so demanding that you feel like you are strained and you cannot give your 100%. So I feel like this is where my abilities and resources are better used. So yeah, I'm super excited.
Awesome. Well, it's past 3:05. Let's go ahead and at least start with some introductions. I did put together a little slide deck that I'll just wait to share so we can all see each other's faces still. I guess I'll go ahead and start. I'm Ashley Autry. I'm a pediatric palliative care physician at Manning Family Children's, and I'm the service line chief of palliative care here and the medical director of our team. I'm also the division chief of palliative care, peds palliative care for LSU New Orleans, and an assistant professor through them. I'm from New Orleans and I went to college and med school here at Tulane. And then I did my pediatric residency and fellowship in Memphis at Le Bonheur and St. Jude. And then I moved back right when I finished training. So in total of my life, I've lived outside of New Orleans for 4 years. And I've been at Manning Family since then. So the past, 7 years. And we'll get to this a little in the presentation after we do introductions. But I have been here 7 years. Our program here was started a year ago. A year before that in like 2018. And this consortium was started by Dr. Alexi Morvant, who started our program here at Manning Family Children's. And she unfortunately was recruited to Stanford and is now their medical director in California. In 2023. So I've been the leader here since then. I was by myself as the only physician the past 3 years. And so that's why we haven't been able to be as proactive with education and networking with this group. And I'm thankful to share that we got another physician in August. And so that's really allowed us to be able to reinvigorate this consortium and bring us all back together. So, I mean, it's really been almost completely 3 years of no activity or communication. So I'm so excited to hear from some of you guys and what y'all are doing. So we'll just kind of start. Let me look at the list of participants. And oh, Jamie, you're the next one on the list. And we'll just kind of share who you are, what your role is on your team, where you're at, and maybe a little fun thing of, you know, a trip or activity or experience that you have coming up in the spring or the summer with this good weather that's coming our way. Jamie, you start.
Well, I'm Jamie Boudreau, and I'm not in a pediatric setting at all, but I sort of try and juggle LMHPCO and how all of the different various pieces and parts that make up end of life care in Louisiana and Mississippi come together. And we're very happy to host the consortium here and bring together all of you today and hopefully in the future. And we have this website now that allows us to create communities. And all of you who are on today's call, if you will log into our website, you will see that when you press on your profile under groups, there's going to be the Gulf States Pediatric Palliative Care. It's our own little social media platform so that you can post questions to all the members of the group. I think we have about 26, 27 people that have expressed interest in this group. So we put you all into this group, and you can sign in at any point in the website using your email address as your username, and we've given you a temporary password of PASS1234 exclamation to get in there. And we will start posting pediatric resources in there for this particular consortium group. So, thank you.
Jamie, have you already sent out those login instructions, or do you mind putting that in the chat?
I can put that in the chat. Will do.
Thank you. Okay, let's see who's next on the list. Brandon.
Hey, what's up, guys?
Not much.
Great to see some familiar faces. So I'm Brandon Malasa, recently transitioned to organization Superior Healthcare that is predominantly in the Greater New Orleans area and Bayou, North Shore, and Baton Rouge markets with home health and hospice. The sad part about that is that they are currently not taking care of pediatric patients. So I am going to do my damnedest to transition that around. So part of what we have to offer here, and just getting our leaders comfortable with the pediatric population. So they I'm 3 weeks on the job, and I think I've mentioned pediatrics every day. So they're getting used to the language very quickly, and like I said, just getting them the resources that they need. So which I'm excited about, and having worked with some of you guys in the past. Knowing the desperate need of things that we built in the past, and bringing that back to life, and getting us to where we need to get to support our community. So looking forward to working with you guys. And I do have to jump off at 3:30, but I want to make sure that I at least had some sort of presence, and count me in on all the future planning and whatnot. And hopefully I can serve you guys more and better in the very near future.
Yeah, I love that you're in New Orleans now, because we definitely need more and more peds. And then just let us know if you need anything to help advocate.
Absolutely. Will do. Thank you. Thank you.
Let's see. Next, Kate Creel. Okay, I'm gonna move to.
Hey,
Oh, you
2
got
seconds.
it?
I think
Yeah,
I got it.
I'm just going alphabetical on the. I'll move on to Clarissa.
Okay, can y'all hear me now?
Yes.
Okay, beautiful. Sorry, I am in a shared office with the fabulous Megan over here. So if you see us like having issues, that's why. I'm Kate. I am one of the new attendings at Manning's Family Children. I started in August of 25. And before that, I worked as a palliative care provider for a year at UT Southwestern Parkland Hospital in Dallas.
And we were sharing something fun that you have coming up or that you're looking forward to, a trip or an experience or an activity for the spring, summer.
Oh, okay. So I really love gardening, and we just obviously, since we just moved to the area, my husband and I spent the weekend building raised beds. So I'm really looking forward to planting in those raised beds, and he is building beehives. So we're hopefully going to try to
Oh,
catch
wow.
a swarm. So he's got his swarm trap set up. And so our hope is that we can have hopefully bees come the spring, and then some yummy vegetables. I have no interest in growing things that I cannot eat. So my goal is to grow veggies.
Love it. Clarissa?
Hi, my name is Clarissa Reynoso. I am a pediatrician by trade, pediatric palliative care here at Our Lady of the Lake Children's Hospital. I was sharing with Ashley that I recently we have started to be more available, so 4 days per week, and I do 1 day in the pediatric academic clinic where I work with our residents here, and I get to see some of my some of my follow-up and patients here, and we're working on a collaboration with one of our local hospices too. For the spring, I have a 2.5-year-old, so she's very active. So she's really looking forward to do a lot of things. I think that the biggest things for us with this new weather is getting out there, going a lot to the zoo, and have her ride her bike because we just recently learned that she can pedal and in that tricycle. So that's pretty much it.
Awesome. I know, I can't wait for it to be, I was looking at pictures from last year and it was already like, I feel like it's been colder this past month.
Mhm.
So I'm ready
Yes,
for
yes, for sure.
some good outdoor weather.
Hmm.
Next is Dana. I'm gonna go ahead and share for Dana. So she is a nurse at Ochsner in New Orleans, and she practices pediatric palliative care there. They are mainly inpatient, but also see patients in clinic as well. And she is LNEC Peach Train the Trainer, which is so exciting. And we hope to start to do some educational offerings with all of our Train the Trainers, so that we can all teach each other. And let's see what else. And has been there for 3 years. And I think her and Emily, our nurse navigator, did LNEC Train the Trainer together. So they were literally traveled out of the state, out of the city, out of the state, obviously, for this training. And it was like, I don't remember, Emily can, maybe like 10 to 15 people, and 2 nurses, pediatric palliative care nurses from New Orleans were there. How cool is that? Okay, next is Miss Jenny Prevost.
There we go. Yeah, so I'm Jenny Prevost. I'm the clinical educator for Hospice of Acadiana in Lafayette. We always have a handful of pediatric patients on service. I think right now we have 4. And so we've kind of, I haven't been here, but about 18 months. And so since I've been here and previous, I think we've been operating a little bit in the dark, trying to figure it out as we go. So we're excited for some extra resources and things like that moving forward to help better care for our pediatric patients. There's no one in our area that specifically or that has a large pediatric population, so I think there's room for us there, and there's definitely interest from the staff and the administration. As far as for the spring, so I'm gonna go back a little bit. We got back from our first ever ski trip this weekend. And so that was something in and of itself. And we're all still recovering. And so we're looking forward to the warmer weather and moving forward from all of the soreness and the bumps and bruises from skiing in New Mexico.
I was about to say, hopefully no major wipeouts.
None. Wipeouts for sure. No major injuries though. So we're considering ourselves lucky.
And Jenny, did you say, or are you a nurse practitioner or a nurse or?
No, I'm a nurse.
Okay. Because I had a couple of people from your organization, but I wasn't sure who was who. Thank you.
Of course.
Let's see, who's next? Who's next? Lisa.
Hi, I'm Lisa Baumgartner. I'm the pediatric chaplain at Children's, Arleta Lake Children's with Dr. Reynoso, and trying to get more of my time dedicated to palliative care. We just have like this much right now, so we're working on expanding my role as we get the team built up over here. So I don't really have any plans coming up except my little bouncy like Odie and Garfield puppy that I have that jumps straight up and down. Trying to get some training for her. That's about all I have coming up.
And Lisa, how much of your time right now is dedicated? What does your palliative dedication look like? How do y'all do that?
Well, right now I'm only 0.6 FTE to the Children's Hospital. I'm at the
Ah,
regional hospital for
gotcha.
the other 0.4. So we're trying to get the other 0.4 to be palliative. So we're working on that currently.
Okay, that's awesome. Then you'll have all the disciplines on.
That's the plan.
Okay, next is Danielle.
Hey, my name is Danielle McMicken. I work at the Lake in adult palliative care, but I do a little bit of peds with Hospice of Baton Rouge and get to work with Clarissa and Jamie a little bit in different projects that we have going on. So I'm just really excited to be here. Where I'm going this spring or summer is really dictated by my 6-year-old, but I think he has decided that he wants to go visit his granny and grampy in Canada in April. So I think we'll be doing a trip out there.
Cool. That's a far one.
Yeah. I think I went about as far as I could, not intentionally. They don't like to come visit in the summer because it's too hot for them.
Well, I was gonna say, yeah, hopefully you'll definitely have better weather up there.
Definitely.
Okay, next is Megan.
Hi, my name is Megan. I am the Peds Palliative NP at Manning Family Children's in New Orleans. My previous nursing background is all NICU, so that's definitely where my passion is. I started here about 2 years ago, and my spring trip is a cruise.
Love it. And I didn't share mine. Yeah, I'm definitely looking forward to a beach trip. Cynthia, is that how you say it? Cynthia?
Yes, that's how you say it. I am an RN and I work for LHC Group, which is now Optum. We were bought out by Optum. I am an RN by trade and have been a hospice nurse for over 30 years, but right now I'm in the quality department. And so I have all of Louisiana doing quality. We have a handful of pediatric patients in different agencies, but I think we're trying to grow that. So just here for information and guidance.
Okay,
And
well,
my spring event will be, I have 6 grandkids and they all come for a week and we call it cousin camp, and we do all sorts of activities and have a good time. So
we were just talking about this as a family this past weekend. What age did you start doing that? Like, you can't have 6 toddlers all together, right?
no, and they range from 2 to 14. Well, 15 actually. He just made 15. So it's 6 of them, but they're all different ages. I only have 3 that are about the same age. So we started it about, I guess, 5 years ago, and we just been adding the newest one every year. So, but we do age appropriate, activities and just have a good time.
That's awesome. Let's see. T Loper?
Hello. I'm sorry. I don't know if I didn't log in right, so where it doesn't show my name, but I'm Tiffany Loper. I am the Assistant Director of Clinical Services with the Hospice of Baton Rouge. And previously, I was an RN case manager here at the Hospice of Baton Rouge, and I'm also the team leader for our pediatric team. We currently have about 16 patients with us on peds hospice, and then we also have palliative care, and we have, how many did you say we have? 9. We have 9 on our palliative care team. And I'm also in here, and I can't figure out how to get our camera on. Oh wait, here it is. Okay. But I'm also in here with Summer Jones. I'll let her introduce herself.
Yeah, I don't think our video is actually gonna work.
Yeah,
But
well,
it is okay.
usually you have 2 places. You have to unslash your video camera at the bottom, and then probably use that slide on your laptop to open up your camera.
Oh yeah, we're used to Microsoft Teams, so there we go. Thank you. It was a little. I never even knew that was there.
There's a little, so yeah, there's a little slide on your camera so you can block people from.
Jamie, look at you teaching technology.
I was about to say,
Go-
IT,
go
Jamie,
figure.
IT.
Hey, add it to the job description, director of IT.
Right.
Yeah. Well, I'm Summer Jones. I am the pediatric social worker for the Hospice of Baton Rouge. So I handle 100% of our pediatric patients that come through on our hospice side, and majority of our palliative care palliative care pediatric patients as well. So I'm really excited about getting to become a part of this, because I really would love to get in contact with any others. As far as I'm aware, I'm the only social worker in the area that does like peds hospice, and so I would really love to get connected with social workers as well as any other professionals that can help me kind of navigate some of the barriers that we find our kids running into. And spring, my trip will be home with my newborn.
She's very pregnant right now.
Very pregnant. So yeah, my trip will be a nice comfortable stay on my couch.
Well, I love that, and so happy to have you join. And I don't see her. I don't think anyone's on here from Heart of Hospice New Orleans, but there is a local Jessica at Heart of Hospice that does social work for their peds. I don't know if I don't think she's solely dedicated to peds, but definitely that's someone that comes up to connect you with. And
Awesome, thank you.
And Christy Heitmeyer did complete the survey and was a part of this group years ago, and she is part of Heart of Hospice Peds part, so she could definitely put you in touch with Jessica.
Great, thank you.
And then Tiffany?
What? Oh, is
Oh,
there
did you
another
want to share
No.
or your spring summer? I guess you already shared.
I don't. Yes, I don't have any. I have a stepdaughter getting married in June, so we're full force with that, and I'm looking forward to the time change. My daughter is down the road at LSU, and so she lives in a dorm right there, so we go walk around the LSU lake. So I'm excited that we can do that, and it's not dark.
And
That's a good
Tiffany,
point.
did you say you were a nurse or a social worker?
I'm a nurse, and I'm also the assistant director of clinical services.
And you lead the Peds team.
Yes.
Awesome. And then I see Judy hopped on with Kate there. Judy?
Hi, I'm Judy Zarang. I'm a palliative care champion here at Manning Families, and I'm delighted to be here with the group.
And Judy's also a representative on the National Hospice of Palliative Care newsletter as well. So if anyone ever has things that they want to share, Judy, did you want to share what the current couple issues are up?
Yeah, right now we're getting ready to put out an issue that'll be published, which is trauma-informed care, basically from a parent perspective. And then the next one will be provider trauma affected care and how we respond to that. And the following one will be on spiritual care. So I'd be very happy to send out, I'm sure you'll have a list for email, and I can send out our guidelines for that, and we welcome everyone's expertise.
Judy, might I suggest that you post those in our new on our new website just for the consortium?
Yes, I'll be happy to do that.
Yeah,
I'll be
thank you.
happy to do that. And then I'm also happy to share that I just joined the education committee. So I'm looking forward to that as well.
And actually, Jamie, that's another thing that maybe you could put in the chat, the link to the new website. If
Yeah,
you're
I did already.
Okay, cool, thanks.
Yes, and how to
Okay.
get and how to log in. And if you have any trouble,
perfect.
and if you have trouble logging in, please send me an email so we can go and look at your profile and see why. And I'll fix it.
Okay, let me share some slides. Okay, so we are just right at the halfway mark. We started with all of our intros, got to know each other. And I kind of gave a little bit of background for the consortium. But this organization, this group was formed in January 2019. And obviously with Jamie here representing LMHPCO, we are originated within the larger Louisiana, Mississippi Hospice Palliative Care Organization. And obviously that group primarily focuses on adult, but is leaning into pediatrics and has embraced us over the past 7 years. So back then in 2019, Dr. Mo did an initial needs assessment. And at that point, it really highlighted the need to kind of start at the end of life and help partner with hospices to transform pediatric care. And around that time, it's actually when they also identified a major issue in the Medicaid concurrent care language. And so that was really one of their biggest efforts was revising the language. They partnered with these national organizations, the Center to Advance Palliative Care, the National Hospice and Palliative Care Organization, some pediatric palliative care physicians around the country, and then local Medicaid and governor's office to make this really big change so that hospices felt more comfortable providing concurrent care to pediatrics, which means that they can, get DME equipment, ventilator, TPN, go to the hospital, go to clinic, go to medical daycare, do all of these things in addition to having the support of hospice if they are eligible based on their prognosis. So that was a huge win from this consortium. And then other things, we did our REACH curriculum, which actually a lot of y'all had participated in. That was one of the goals that the consortium had set when they first originated. And we hope to figure out a way to have more recurring education besides the REACH curriculum. That, for those who aren't familiar, that was a 12-month, it was a monthly session, session for a year. And that was in partnership with LMHPCO and utilize the curriculum out of St. Jude that we're working on publishing. So that's another option of, if there is a need in this consortium to repeat that curriculum, that would be something that we could think about moving forward. Another thing
Just
that
and for those who are not familiar with all of those videos, all of those sessions were videotaped, and they are available on our website under pediatric palliative care.
Yes, in the REACH program, it's meant to be a community hub and spoke model where like we all teach each other. And so watching the sessions obviously is good education. There's a didactic, usually like half of the session was teaching and the other half was case-based discussion. And the goal would be, if we were to repeat it, that you guys could submit real-time cases that you're dealing with, and we could, as a group, troubleshoot it together. So you can certainly watch the videos. We actually have a lot of our learners watch the videos as an education tool. So that's something that y'all could share with your learners as well. But the goal, if we were to repeat it, it would be kind of a give and take community building model. And then a hospice checklist. So our group, and we're happy to share our hospice handoff checklist, but the checklist was created with a goal of trying to give more handoff and help transition from inpatient to out home, especially with hospice support for pediatric patients. So we give guidance based on like conversations we've had with the family. We give medication guidance, and we also have links at the bottom for hospices, like the Blue Book for Dana-Farber for symptom management, the Courageous Parents Network End of Life Parental Guide. So different things like that. And we're happy to share if anyone isn't utilizing something like that or is interested in for inpatient programs utilizing that. And then we created a website, which Jamie has referenced. So we have a pediatric specific website within the LMHPCO website where you can go to find resources for symptom management or Courageous Parents Network or whatever it may be. But we do hope to improve on the networking piece. And that is what I think that might be something that we do at our next meeting, Jamie. Maybe you like sharing your screen and showing people the new community part of it. And then some of our other goals, we did have this was a goal from the consortium originally, was an annual pre-conference, which would be so awesome for us to be able to do. We did do one pediatric pre-conference at the annual LMHPCO conference in 2021. So it has been a while, and that's something that we can talk more about as well. So, and that is a big dream that we haven't yet accomplished. You know what? I'm just realizing, hold on. Well, I think this is right. Okay. So I don't need to tell you guys what pediatric palliative care is, but there's so many different definitions, and this is kind of the one that we stick with. And just shows that we're beneficial at any stage, we're interdisciplinary, and our goal is to treat and prevent suffering on all forms, physical, psychological, social, and spiritual, of both the patient and their family and caregivers. And then you guys know this of why, unfortunately, I think a lot of people in the adult world don't realize that kids need pediatric palliative care and kids need hospice too. And so unfortunately that is the reality. And sometimes we have to show that to advocate for more resources. So this was the original vision of this group, that all children and families in the Gulf State region facing serious illness will have access to comprehensive support through the entire duration of their illness, both in the hospital and the home, with the goal to prevent, anticipate, and mitigate suffering in all of its forms. And our mission statement is that we'll achieve our vision through an interdisciplinary workforce, advocating for every child and family to have access to support necessary to live as well as possible, just even with their serious illness. And those are just some of the ways that we aim to do that on the bottom. And then I'm going to dive into our needs assessment. So, there's already more of us than 23, which is so awesome. So please make sure to fill out the survey if you haven't already. But based on the survey responses, we have 23 members representing 6 hospitals, 7 hospice companies, and 7 disciplines. So the hospital is represented. And if you don't see, of course, if you don't see your organization here, please make sure to fill out the survey or to email or chat me. But these are the hospitals. So really, I mean, New Orleans, Shreveport, Lafayette, and Baton Rouge. And then the hospice organizations, Baton Rouge, Hospice of Baton Rouge, and which is, I don't know if I realized that you guys do pediatric palliative care in the home, which is so amazing. And so does Hospice of Acadiana. So such a huge resource to have in Baton Rouge and Lafayette. And unfortunately, one that we don't have here in New Orleans. St. Tammany Parish Hospice, North Oaks Hospice, and then Allegiance and Sanctuary Hospice, which is in Tupelo. So some Mississippi representation as well. Dr. Sonia Malhotra, she didn't fill out the survey, but she also provides some pediatric palliative care at University of Medical Center here in New Orleans. and mainly with pediatric trauma cases. She's med peds trained, actually triple boarded and board certified. And then in our needs assessment, we had 5 physicians, 2 advanced practice providers, 6 nurses, 3 social workers, 1 chaplain, 1 child life specialist, and then 3 hospice administrators. So really, that we're really checking that box for interdisciplinary. And like Summer had said, hoping to connect there. We have 3 social workers on here. We have 2, they're not on the call now, so they filled out the survey. So we have 2 dedicated pediatric palliative care social workers here at Manning Family Children's, Summer actually, Summer McDaniel, and Sarah Jane, she goes by Jane Phillips. So they'll also be part of this group as well. And as I mentioned, if you feel like you're missing somewhere in here, please let me know. And the survey links in the chat. So we learned that 12 of us are providing pediatric palliative care. 8 are offering pediatric hospice, 3 are offering perinatal hospice, and 2 perinatal palliative care. A little over half of us, 57%, are confident or very confident, so like a 4 or 5 on a scale of 5, in providing pediatric palliative care. 30% moderate, and then none of us, thankfully, are only slightly or not at all confident. So I'm glad to hear that. And then 63% of us have received specific pediatric training. And this is some of that training. So Jamie, I was so happy, 21% participated in REACH. So that's awesome. And since that was now at this point 4 years ago, which is crazy. And then we have Kate, who is going to be Vital Talk faculty. We have 4 nurses who are LNAC Peds several nurses, and not just nurses, I'm sorry, participants, completed LNAC Peds, and then 4 of them have trained the trainer status. So they're able to teach the rest of us and teach their own at their own hospitals. So that's a huge asset for our consortium. And then Epic Peds as well. And we have 1 train the trainer, and soon to be 2, our nurse practitioner, Megan, will be completing that as well. And then Megan also recently completed Pain Masters, and then some resolve through sharing for Judy as well. So many, and sorry, this is just, I need to make some good like pie charts and things, but this was the brief overview, trying to pull out some of the highlights. And then this was the needs of this group in order of importance based on the survey. So, sorry. I wanted to show them all first, and it's already 3:40, so I know we're not going to get through all of this, but please, feel free to shout out anything. I don't want to talk the whole time, but I worry we don't have enough time for the discussion that this would warrant. But some of the ideas, so for peer support, which kind of goes along with networking as well, thinking about having quarterly versus monthly meetings where it might even just be like 30 minutes of like, hey, what's going on? It could be, obviously, a lot of it's going to be like planning for the future and what this organization, what kind of education do we want to offer each other or offer LMHPCO outside of just this group, like improving education for mainly adult providers who may take care of pediatrics at the LMHPCO conference. But there could also just be like 30-minute like debrief sessions where we all just come together and talk about whatever's been tough. So when I say monthly meetings, it doesn't necessarily mean they have to be like this, where there's a PowerPoint or an education. It could also just be community. So that's something, feel free to throw something in the chat if you think quarterly or monthly. And I may send another survey to try and gauge this. And then also any other ideas for peer support. Obviously, Jamie has the community website where we can kind of I believe contact each other within that website as well. So if you have a tough case and you want to kind of ask the group, what would you do? You can do that as well. And when we think about that networking and peer support and how to be there for each other, I also wonder about ideal time for meetings. I had someone tell me, which I didn't think about, because all my kids go to aftercare, but like 3 o'clock is hard because she has to go pick up her kids at 3 o'clock. So I was like, oh yeah, like maybe having an earlier afternoon meeting is better, or a lunch meeting. So that's the kind of stuff that'll be helpful to learn from each other. And then shared resources, like we mentioned, there is a website with some resources on there, but we want to know, like, are those helpful, and what can we add there? And again, feeling free to come to the group and ask for something specific that you need. Another idea, the LMHPCO conference, it's a little, I guess it's not too late. It's at the end of July. But thoughts of having like a pediatric Gulf State, our consortium, like happy hour, and all getting together there for those that will be attending. So just little ideas along the way of how we can build this community and get to know each other. The virtual education learning opportunities, I think, like we mentioned, either we could repeat the REACH curriculum, which is a monthly session over a 12-month period. We could do monthly meetings and do every other meeting with education topics. It really could look however this group wants it to look. And then the in-person education is really the LMHPCO conference, which is every year at the end of July. Jamie, it alternates, it's always in New Orleans, or it alternates between?
It has always been in New Orleans.
Okay.
And the date for the clinical sessions are going to be Thursday, July 30th. That's when we're looking for the first day is administrative, the second day is clinical. So if all of those folks that you had identified with special talents, we would love for you to consider presenting a session on pediatric. We're going to have at least 7 different on Thursday there will be 7 different sets, and there will be 7 sessions in each set, so we could certainly have 7 pediatric presentations on that day. So
And when's the deadline to submit for session, like teaching?
the deadline is actually going to be March. Well, it's supposed to be March 3rd, but I mean we'll take presentations until we fill all of those 49 different slots. But what I can do is I will put the link for sessions in the chat box today as well. And if you can just click on it and consider doing a program for us.
Yeah, please. Anyone thinking about submitting something, please don't hesitate, because it would be there's been, I imagine, very little, if any, pediatric content the past few years. And that's definitely something that we can work towards, obviously, for next year as we build this consortium. So I'm going to pause there before kind of speaking about so we're kind of halfway through these. Anyone else with ideas I haven't thought of, or and again, you can share here, share in the chat, or email separately.
In the chat box, you will see I put the instructions for you to log in to the website at lmhpco.org. And once you do that, you hit your profile, and then you hit groups, and you should see Gulf States Pediatric Consortium as one of your groups or communities. I've also put on here a link to our website with all of the resources that we currently have up for pediatric palliative care, including there's a little box that you click on for REACH, and all of the videos are there, as well as links to the Blue Book and all sorts of resources there. And then the third link that you see in the chat box is actually the link to the LMHPCO call for proposals for the conference this summer.
Yeah, like for example, Clarissa, even like a story of how you successfully advocated for your protected time or for your dedicated social worker. You know, it doesn't have to be research or a case report. You know, it could just be what you guys are doing and how.
The idea is to get more and more folks thinking about pediatric palliative care and hospice.
Yes.
Mm.
Um,
Something that I was thinking about also, which has been in my mind and everything, is like, you know, especially in pediatric palliative care, with prenatal diagnosis, we have had there has been a whole shift of culture, even in offering certain surgical procedures on these patients, like how will be beneficial of, and you know, I know that a lot of our colleagues don't think that they're still working on the mainframe, like, you know, these patients are poor surgical candidates and they don't need to go undergoing that. So I was, you know, I've been having this idea of like, how do we portray this to like our families and the need for like, if we have an integrated multidisciplinary team along with like these surgical decisions, how the outcome that comes with like in those families, like giving the opportunity of, you know, supporting them throughout the whole after the diagnosis and through in those decisions that need to be made. So, you know, I think that could work.
Oh, yeah, and that's such a unique thing in pediatrics, and in hospice, right? Because like I feel like our pediatric patients on hospice still face those decisions, and I think that's one of the biggest hurdles that more adult focused providers have to navigate in the hospice world. And sorry, not providers, clinicians, of like how to help them make these decisions. As opposed to just focusing on comfort focused care, like the more traditional hospice model. So I think that the LMHPCO audience could really benefit from some kind of presentation like that. Any other ideas for peers, so how to support each other, like integrating education, meeting at good times?
One thing I should say is when you log into the and go to your profile, we only have your email address and your name in there currently, along with where you told us you are currently located. We don't have your telephone number or things like that. You're free to put that in there, and that information will only be seen by the other members of the consortium. Whatever you put in your profile, in terms of the way in which you want to be contacted. Right now, it's just through email, but if you'd like to put your cell number, you can put your mobile number in there, and that will give people, only people in the consortium, I should say, access to that sort of information.
Yeah, that actually brings me to the next topic that our need was the creation of a pediatric palliative care provider map/directory. So in the needs assessment, everyone had put their emails and phone numbers. And like I said, I'll probably send another survey to kind of tease out some of these things, but the thought would be that we share at least the names, organizations, and emails with the group. And that way, again, if anyone has a question or even patient care coordination, a patient that they are trying to find resources for, we'll know where to go and who to reach out to. So that's another goal. And yeah, it sounds like they're already at that capability within the website form to share that information with each other. And then Lisa, I see, yes, totally. I think, Jamie, right? Aren't there chaplain attendees at the LMHP hospital and a lot of hospice chaplains?
Sure.
So I definitely think,
Yeah.
and not obviously, not just for chaplain as an audience as well, but for the nurses and physicians to
I was going to say,
as well.
nurses and social workers are frequently going into the spiritual care. You know, it's all connected. Remember, it's all connected.
And we're kind of getting, low on time, so I definitely don't want to hold anyone late on the Wednesday afternoon. So the other ideas, advocacy opportunities. We talked about patient care coordination and then research opportunities.
Right.
This is just a very general, some ideas, like if we were to kind of have a couple people working on this, a couple people on this, some ideas that we could have for committees and be able to accomplish these things and like update each other at the monthly meetings or quarterly meetings. So these are, again, are just ideas and totally open to feedback. And I might put in a survey like a spot where you can indicate any specific interests that you'd like to lean into. So we've talked about a lot of this already, but education, planning sessions for each other, but also thinking about pediatric content for the larger LMHPCO community, whether that's at a conference or in their newsletter or through Judy's NHPCO, the more national focused newsletter. Thinking about REACH curriculum, if we do that again, or do we want a journal club, looking at pediatric articles. Utilization and resources, again, that's mainly updating, like really making sure that the website is as helpful as it can be. Advocacy, like Clarissa did on her team, advocating for social work, for more formalized IDTs across the state. I think until Clarissa had that success recently, and correct me if I'm wrong, but I'm pretty sure Ochsner, it was only New Orleans that had dedicated nurse, social work, physician to palliative care. So it's so amazing that that's extending throughout the state, and we can all learn from that and advocate for that. Concurrent care, making sure that hospices and inpatient teams aren't facing issues or being told that patients can't have something because of hospice. Networking, building resilience, preventing burnout, because there's so few of us and we all need to keep on keeping on taking care of each other and our patients. And so how can we do that in a meaningful way? And then data collection, as I've mentioned, I love surveys. So, you know, how do we describe our workforce, really have an idea? You know, we have some representation of whole teams, like or actually like half my team is on, but there may only be one person from a peds team at the hospice. And so learning more about what their entire team looks like and describing our workforce. And then eliciting the committee interests, learning topics, and then goals for the consortium for the future. So that's a lot. I think that's about all oh, this is just an overview of that as well. Kind of repeating a lot of what we talked about. And pediatric palliative care across the care continuum. That's definitely, you know, even our team, we're lucky to have a robust team of 6 fully dedicated pediatric interdisciplinary clinicians, but we're really only inpatient still. And so there's so much outpatient need, perinatal need. So thinking about ways that we can grow our teams and or our services. And then we've covered a lot of these topics as well. So just to wrap up, spreading the word to your colleagues. So if you are on a team, please share the link with the rest of your team so that everyone on the team can have access to the consortium and we can have a good idea of our workforce and who all's out there providing this care. Remember that you're not alone. There's so many of us doing this same work around the state, even though it feels like there's so few. And that pediatric palliative care and pediatric hospice is going to be used more and more as, you know, treatments and technology grow. And so our kiddos are going to be living longer, and they're going to need more and more support and more hospice utilization. And then let us know if you're facing any issues with concurrent care. That's such a huge piece of pediatric palliative and hospice care. And please reach out when needed. Obviously, you have the consortium, my email through the consortium. And if you don't, Jamie, can you put the email?
Yeah, pediatrics at lmhpco.org.
Yes,
That.
Yep, that gets you to me. But like I said, I think, For right now, if you guys are comfortable with it, I'm gonna stop sharing so we can see each other for the last couple minutes. I think I'm gonna do like, Jamie, if you don't mind sending an email, like an opt-out approach. Do y'all think that's okay? Where I'll say that like we're gonna share the emails, just emails, and it's within, you have to log in to see it. So it's not gonna be a public facing
Right.
directory or anything like that. So you log in to see it, and it's just this group that can see your name, where you're at, and your email.
Exactly.
Does anyone
Yes.
object to that approach? And we'll send out an email, and if people disagree, they can respond to us. And then, so we'll do that, and then maybe give a deadline of like a week, Jamie, and then we'll make that available within the website so y'all can see everyone's emails.
Right.
Does that
Well,
sound like a good plan?
and it also reminds me, we have, Ashley and I have a meeting with our lobbyists tomorrow to discuss a bill that's being introduced called the Perinatal Hospice Notification Law. We don't know what this is about. We'll learn about it tomorrow. And then once we get the bill, we'll also put this in the group so that you all can look at this bill and tell us where the problems are, or if this is a good idea. We don't know yet what this is. Yeah.
I think, Jamie, this is the one that already passed in 2023.
I think this is a proposal.
Unless there's,
This is a proposed expansion of that law.
okay, so yeah, we're gonna talk more about it, but I
Yeah.
might, that's actually,
Jesse
if anyone needs to go, feel free. Oh, was someone talking?
No.
Okay. If anyone needs to go, feel free to jump off. But yeah, that's perinatal hospice. For those that are providing perinatal hospice palliative care, there are notification laws, and there's 14 states so far that have passed perinatal hospice notification laws. And so what they mean is that it varies by state, but basically a lot of them are when a fetal anomaly is diagnosed, OB providers are required to give a list of perinatal palliative care hospice resources and organizations. And they don't define what that care looks like. And a lot of them, like in Louisiana, there's no list. Like, what does that look like? And even us, like, we all practice this and we don't even know who's doing it. So it's definitely important to be aware of these things going on. And that's actually we are working on a national project looking at all the state laws, and it should be published in the next couple weeks. So I may submit that for LMHPCO to be aware, to be able to share that.
My point is, we're going to be putting a lot of documents there for people to look at and give us your thoughts on it. Okay.
Because one of the things that I find and I'm actually like looking into is getting more training in how perinatal palliative care, right? Because I don't know you, Ashley, but like in my case, even I work with adults, but I mostly at the beginning of my career during my fellowship, but I really didn't have, even if you do pediatrics, I'm not sure that you have like a very specific kind of like, okay, this is what you're gonna do in perinatal palliative care. Like most of us have learned, the principles are the same, but like the setting is totally different. And because we're pediatricians and attend sometime these settings of like labor and delivery, or get to have prenatal consults sometimes. That's how you kind of know what is it about developing, but I don't know what your thoughts are. Like I never got like a formal training of like, this is how do you conduct this visit, this is how you make, create a labor and delivery plan. I don't know.
Yeah, it's definitely like same here. We intentionally don't provide that service yet because we don't have the capacity, mainly in medical staff. But we definitely have thought about how and continue to brainstorm about how we will do that when we're able to, so that we can do it well. And agree, like I think that requires specific perinatal training. And I haven't dove into exactly like what I would do yet. So if you find national resources, but I agree. I think the birth planning is different, but I do think that the pediatric providers are the experts in terms of like trisomy 13, trisomy, like we are going to be the best people to counsel on what that could look like in collaboration, obviously, with the subspecialists. But I do think that birth planning and perinatal requires specific training too, that I plan to do when we are offering that service.
Let
So
me know
you're doing perinatal too
when
now?
you want to do that.
You're doing perinatal too now?
No, not really, but we do have, there's Women's Hospital, which is our like birthing center. We receive a lot of babies. I work very closely with the NICU. I actually round almost every day with them, so we receive a lot of babies
Yeah.
from them. So like, it's interesting to see like how can we support like from the beginning of the diagnosis, right? Like I know that our colleagues in the big hospital, they have a contract to provide palliative care to the adults, but not necessarily, I don't know if they go like to the NICUs or anything. But it would be interesting to explore like something like a collaboration where you can get involved in those conversations earlier and provide families with some guidance and support before they even are after they're born, and if they do want to pursue life-sustaining, surgical interventions or treatment, then they can continue with with the planning and that creation of goals of care for kids. So just thinking about that.
Well, I don't want to hold you guys, and I just want to thank you all so much for leaning in and making time in your day to, one, complete my survey, and two, come to our first meeting. And I can't wait to figure out when we will plan the next one. And it's so nice to see some familiar faces and meet some new people too.
Yes.
Okay, we'll see you guys.
Thank
Take
you
care.
so much.
Thank you.
Appreciate it.
Of
Bye-bye.
course.
Bye.